My name is Sandra Mwarania. I am a reproductive and maternal health advocate working with White Ribbon Alliance Kenya. We are a people-led movement of passionate advocates like myself who champion for the health and well-being of women and girls all over the world.
Hello, welcome once again to another episode of Necklace Forum, and today we have Sandra Mwarania. Sandra is an activist, an anthropologist, and very passionate about women issues, particularly health.
Yes.
So Sandra, tell us more about yourself.
You've done such a great job introducing. I really take people's well-being seriously. And that cuts across health, it cuts across development, it cuts across livelihoods. And so I find myself in spaces where I'm always championing for people's well-being, but more so those that do not have the platforms to speak for themselves. And that's how I found myself at White Ribbon Alliance, because as a movement, we are so passionate about ensuring that the well-being and health of women and girls is taken seriously. For far too long, we've had the stories, we've had the experiences that culturally women and girls are not prioritized. The issues are not prioritized, and then even this shows up in health, where even you find that as far as investment from investment from policymakers, investment from decision makers, as far as putting money and budgets and resources to strengthen the health system for women and girls, it's lacking. And so just coming back to even what defines speaking, what speaking out means is we need to change the system so that it truly invests in women and girls. It starts by talking to women and girls and asking them, because it's not about speaking on their behalf, it's them speaking out. We know that they have knowledge, and that's something that we always say, we're not coming to give you knowledge, you have innate knowledge and power, you just need to be given a platform and maybe some skills, because you also have, there are things that you have to, many
to sharpen your skills more.
People don't, and I think that's something that also we're trying to then disrupt and dismantle, that the idea that we are coming to empower you. No, we're not coming to empower you, we're just coming to show you, by the way, you have power to actually change things. You have skills, innate skills, but we'll offer you the platform. So we do that. A lot of our leaders take that for granted, and not even for granted, they really they pick on that as our weakness, that we do not know our rights, and they exploit that
instead of using it as an opportunity to teach us more.
They're very happy when we are ignorant and even apathetic, when we don't really care. They're really happy with that, because then they can manipulate the system. Especially mothers who come from the lower socioeconomic background, you find that their access to maternal health care or even reproductive health care is so frustrated right from the point of
conception.
Even just from for a mother, from the whole period where the antenatal period to when she wants to give birth, to even after. There are so many barriers that are financial barriers, barriers of
access to nutrition,
and then
food.
Access to nutrition and food, especially during the pregnancy, but even attitudes of health workers. And all of this, what we've said as a movement is, do these women know that as mothers or as pregnant women that they have rights? Forget about the right to health, the usual Bill of Rights that we sing. As mothers, their rights to their maternal health services and their maternal health care, e.g., they should be called by name, that they should be treated respectfully, that they should even have a birth companion, that they should get informed consent. The reality of a mother or a young woman accessing a maternal health services in Kenya is, they go, if they're young, woe to you, because you're going to be mistreated, you'll be told you're wasting my time, you'll be told
you can even be abused.
In fact, abuse is it happens all the time. And actually, when you talk to these mothers, what they tell you is, it happened to my mom, it happened to my sister. Tunaambiwa tutu tujikaze, tuende we give birth, and then we go. And in unfortunate circumstances where, because of that, disrespect and abuse, that they end up losing the babies, which happens a lot. They are then told, as if that is not bad, they're told, don't worry, you'll get another child.
Another one.
Right? And it is such things that now even anger us as advocates.
And even prenatal classes, you see, it should be free because people need to be told how contractions take place, what is expected of them. And,
absolutely.
Young girls go there and they don't even know how to push. And so children die because the young person does not know how to push.
And that's it. In fact, that's what you've just said is what pains me and what drives my work. Because you realize that we live in a system that completely doesn't see these things. It's invisible. They treat you as really a client or as something that's passive. It's like a factory. In fact, when I was hearing the details of like the process of you as a young mother or first-time mother going to the hospital, they describe it like it's part of there's a line of, there are many of you, and when you're going through a process. I think about the psychological well-being and mental well-being. I think of the fact, me first of all, I'm a mom as well, and I was a new mom last year. So I was even getting these stories just as I'd gone through the process, which I was very extra. From the pregnancy period to when I actually gave birth, I was very extra, right? And I was also very scared. Yeah. And I'm talking to myself who has, in fact, read these things. Yeah. I have had these things, but even then I was scared. And I even had a supportive system.
Because you really don't know what to expect.
Yeah, and I still had a supportive system. So when I come to talk to mothers who are even younger than me when they were pregnant and about to give birth, and they have zero support system, and they are, it's almost like, in fact, for some of them, they had talked about how being pregnant, it's a life or death situation, right? Because they don't know at the end of this journey whether they're going to be alive, whether the child is going to be alive. And so that is the reality of the healthcare system for women, especially in the maternal health area, where it is important for them to actually even understand from the get-go, you as a woman, you have rights. Anytime you go and seek healthcare, you have these rights. When you're going to seek maternal health care, these are the things that you should expect because no one tells you, right? No, there's a culture actually even in Kenya, I feel.
Actually, you are not supposed to question the doctor.
You don't question the doctor. You don't question what you're being told. There's so many, you can poke so many holes, and that is why it's important. So one, understand what exactly you are entitled to, because all of these they're actually provided, and we have so many policies and so many even laws that safeguard your rights and safeguard the quality of service that you're going to get when you seek healthcare, or even when you're at home, because there's also the aspect of self-care where you don't wait to go to the hospital. It also comes to you as an individual. Do you know what it takes to actually seek information for your own health? What are you consuming if it's food? What are you consuming if it's even media?
Even supplements that you need to take.
That influences how you are and how you behave and your stress factors. And so it starts from the house, and that is information that we always say needs to be tip of the fingers. That is the innate knowledge that we tell women and girls you have. And we saw the power of the curating evidence when we did a campaign last year. It was called the What Women Want campaign.
Oh, I saw it.
Yeah. And the What Women Want campaign was inspired by the idea that almost all the time, when we have health policymakers, health decision makers, health experts and financiers coming together to plan policies for health, they use what we call the perceived problem. What is the perceived problem based on what they've,
what they've heard,
what they've read,
what NGOs the world over are doing,
what research has generated,
but they've not tailored it to this particular group.
And we how we even showed it came very clearly how we did the campaign was, it was a global listening exercise. We actually managed to talk to around 1.2 million women and girls across the world. And we only asked them one question. We didn't give them a questionnaire for CG, whatever, what's your name, and it was, tell us, what does quality maternal and productive healthcare mean to you? Define it, right? Define what that means. And the answers that came out were quite, not even shocking, diverse, and also quite very personal. So we found in Kenya, the top 10 demands for quality maternal and reproductive healthcare was water and sanitation. And how they broke it down was, I want to go to a hospital and there is a clean toilet. I want to go to a hospital and I find the bed sheets are clean. I do not want to share beds. In fact, that was the number one in Kenya.
I
right?
don't like that part.
Right?
Yeah.
Number 2 was respect and dignity, which speaks to me. I want to come to the hospital and we talk like human beings. Don't treat me like you're doing me a favor, right? Speak to me. And that one really hit home for the maternal healthcare system here, where you're abused and in fact,
and
it's
even when
so
you are called
cruel and crude.
you know, the way they are called loudly in the corridors.
Yeah.
To go and receive treatment.
Imagine, it's like, I'm sorry, I'm here, but I'm not sorry. I'm a taxpayer, I'm also paying, I'm paying for these services. And then the third one was around menstrual health, where the girls and women alike were saying that we want access to medication for cramps. We want access to menstrual products, which at least we know that there's momentum around that third one. But the idea was, when you go to the books, you will hear, and this is what now you get from the global health actors and even the national health actors who are making these decisions, that for reproductive and maternal health care, it is a sophisticated maternal health ward. Yeah. So you find a lot of projects actually, and programming is tailored around, let's build a maternal and neonatal ward, let us let's buy more commodities, and at the end of the day, as much as those are important, the women and girls that are saying they don't mind going to a very simple building,
hospital,
and having
clinic
that is clean, and the people are friendly, and that they get the services that they deserve. When we talk about these rights, we have and all of this, by the way, you can find them the package really well under the Universal Respectful Maternity Care Charter, and what we say is this information is not just for women and girls. It is also for those who are around them, because they're not going to live in isolation.
They need to know how to help this woman in case she needs assistance.
So their partners, their families, their communities also need to be part of this conversation. Otherwise, then we're just speaking to ourselves. Right?
And I think
that's important.
It's quite also important to also just this training and talking to girls about this, because traditionally when you have a baby, your mother is there to take care of you, your aunt is there to take care of you. Because if people have the natural birth, they're told how to sit on salt. Now you are in the city alone. Your mother is also still young and working. You have nobody even to tell you how to use the water and salt, but you've been given salt and you've been told go and put in hot water. So you don't know. You hear some people sit on it, some people put in hot towel. You don't know which one is which. And all these, somebody tells you they've taken long to heal because they are scared. Hot water and salt is really not something easy.
I can
so you
imagine.
really need to push yourself, and somebody really needs to make you understand why you have to do that. And then, because we have got cases of fistula that happen because of birth, but we have got cases of fistula that happen because of they were not taken care of well after delivery.
Exactly. In fact, you've just made a point that has made me also reflect. The idea that, and it comes back to what informs our systems, what informs our current health practices. And I sometimes we not even, because I know I've shared this sentiment with others and they've shared the same. Who said that the current way of doing things is the standard?
It's the standard. No,
right?
It's not.
And I say that because, especially coming from Africa, and I'm a Pan-Africanist, I really believe I'm very passionate about our culture and the knowledge and gems that we can find within our practices, and that have been completely diluted by
but some are really good
standards. And so when as we talk about even like the maternal health practices, I don't know at what point our traditional systems were put on the side. In fact, more often than not, if we see it in programming, it's like we need to enable more skilled birth attendants. We need to bring, a lot of the skills that are being brought from a foreign context. Even as we're talking about, yes, you have your rights, yes, this is how you can take action, but also interrogate where you're from, and do not demean
what the practices
that knowledge.
Because even the issue of according to modern healthcare, they say 2 weeks is when you need to go for checkup. Traditionally, those 2 weeks you are not supposed to touch or do anything. Even your baby is to be washed for you. But now you see, here you've just given birth, you're washing your own baby, you're told you can clean the clothes while standing, yet that standing is not good for your back. You need to lie down, you need to sit with your legs together, and that's why you're lying a lot. But if you're walking, you're going to take long to heal. And so these are things that, it's not about modernity, it's about what is it that we value as a system, whether it's traditional or modern, are looking at this woman. And we have got instances where men tell the woman, my mother started cooking for us 1 week after our hospital and she was going to the garden.
Oh my gosh.
So you just can't cook for us 1 week and you...
Kwanza that one.
And you just gave birth. So we are not going to eat because you gave birth.
That, and then also demanding for their conjugal rights, which I'm just... And that's the thing, right? Like sometimes the information, and unfortunately very many mothers are not privy to some of this information. And so that when they're getting such talks from their partners, and there's that power dynamic, of course they're going to give in. They're going to give in, and then at the end of the day impact their health.
Because you're told 6 weeks, and then you find somebody like 6 weeks, me, I stay a whole month. And you're like, I mean, sir, kindly, can't you just wait?
And that's why we need to have, it needs to be a community conversation, because, and that's another thing, right? Maternal health is not just a mother's issue, it's not just about women, it's literally the whole community, because at the end of the day, we always say, healthy mothers, healthier nation. So it's you have to build from that level where there's investment, even as we're talking about national systems and policymakers, even you as a partner, as a family member, as a community, what are you doing to ensure that your women are healthy and safe and they are enabled to actually be productive? Because it also speaks to the mental health, and because like what we've just said around, there's this power dynamic that plays out. What does it do to the mental health well-being of the woman? Me, I know for sure, I can tell you, my first 2 weeks, I was such a mess. I was such a mess. First, a new mother, and then there's so many. In fact, I realized even me, I find myself, I'm very privileged. I always call out my privilege. In my privileged situation, how is it that I did not know so many things as a mom around breastfeeding? How did I not know that I would be feeling certain way? How did I not know that? And we live in a system, like you're saying, not even just for women who come from certain backgrounds, but even for working class women. By the third month, you're being told to go to work. You're still figuring out what's going on. You have your child that you're thinking of. You have your family that's pressuring you. And so there's a lot, there's so many things that need to be...
Actually, for a working class woman, I always think the pressure is a lot.
We cannot delink this from what's going on at the decision-making space.
Exactly.
It is so, because as much, the problem will persist, the status quo will be maintained until you actually make enough noise to cause change at the policy level, to cause change at the service provider level, right? So this means also, and that's something that we also do, is creating spaces where leaders and women talk.
Exactly, like now the leave. Like even if they're telling us the maternal leave is 3 months, can they tell us it's 3 months, then after that, the other 3 months is half day. So that you breastfeed the child, you go to work half day and you run back home, because here you're coming again, you are clogged. You are tired, you reach home, you're told you can't give the baby the clogged milk, you have to press it out. Is when you breastfeed the baby, it's a whole lot.
I think last year we'd seen that there's this policy that was passed around breastfeeding in the workplace, which I thought was very progressive and very good, and it was a national thing. But what you're saying is also so important, like just having a breastfeeding room, a lactation room, it doesn't fix the problem.
Because you see, when you talk about lactation room, it's very nice for big organizations. But now the small organizations, even if they wanted, they don't even have that extra room.
It's true. There's also that. It is true.
I get it. My next question, I want to ask, why are you, Sandra, so passionate about this?
Man, are you seeing how broken the system is? Because, there's this thing of, first of all, I'm always proud of my activism, and that started when I was in uni. Right? It started when I was complaining about how as students, we're not getting the services that, I was part of student leadership. And I found out then that the money that we're being given to do student activities was being eaten by the admin. So you're there as a leader and you're accountable to the students who have elected you. And so that started that idea that haya kuna watu, there are crooks in this world that really take advantage of situations. And so that feeling of obviously, speaking out for people, speaking out for things started then. But then more so, as I grew and as I started working directly with communities across different areas, it was housing, there was education, and then I hit health. Because I started doing health when I was pregnant. And so I found it became very personal. It actually went another level. It wasn't just because, I'm an activist and this is what I do. But for the health part, I took it personally because I'm a woman. And then I've now become a mother. And I could see the stark difference. The minute I saw that difference, it just reignited. The fire that has always been there, I'm like, no. This is simply not right. In a country that prides itself with Linda Mama, a country that prides itself with
free maternal health
and
care.
Beyond Zero, it's a national commitment. How is it that almost more than half of our population is having a different experience when they seek health care?
The one thing about having a baby or let me say pregnancy, it's not something we can say, okay, we will stop having babies. So until we have good maternal health care. This is a natural system. It's a natural occurrence. As in we are not going, let's not talk about like the teen pregnancies, but even without the teen pregnancies, the number of women of mature age getting pregnant is something we can't control. It's nature.
And every day, and just every day I find that there's something that nudges me forward, because right now I'm now working closely with women and girls with disabilities. Their whole experience is like another whole, like in fact it even made, I was even embarrassed to realize how blind I am to the realities of people living with disabilities. As me are complaining about women who are being talked to badly, I'm not thinking, by the way, if I'm deaf, is a hospital actually equipped
Do they have anyone even to
when
communicate
I'm in pain?
To me?
Because first of all, during labor, that's like a lot is dependent on your physical reaction. Right? And if I can't cry, if I cannot express what I'm feeling,
or even to call a nurse to come.
So you think about that. If I am physically disabled, the beds in hospitals are not disability friendly. In fact, there are so many women who, and it breaks my heart, women who say when they go to hospitals, they have to walk on their legs because there's nothing on the floor to go to the bathroom or to the washroom. This is you pregnant. And that's because there's a system that has completely assumed that, first of all, blanket rules for everyone. They don't realize the different realities of women and girls. But more so that there's no investment. They do not want to invest in actually making services quality and suitable for the clients that they serve. Because I know in the health facilities they call them clients. So right now I'm working with women and girls with disabilities, and we are actually the work, and that's why women the passion just grows, because for them what they want to see is when they go to a health facility that it's equitable and it's inclusive. And what does that mean? When they go, they find that of course sanitation is there, but then also that the health workers are enough and competent to respond to their needs as PWDs, that the health center is disability friendly, right? And people talk about ramps, but even it speaks to the social environment,
even the chairs where they are going to sit,
but also the attitude of the health workers, right? It has to be friendly. It speaks to medicines and supplies. In Bungoma, they told us that there's this lady with albinism who said the products are not there, the lotions and creams that they need are not there. There's always stock out. And so it is such stories, the personal stories, that always nudge me, because it's almost like always proving how broken the system is. And so instead of getting frustrated and angry and easily apathetic and say, well, it is what it is, then you find yourself in spaces like this. I personally came to White Ribbon Alliance because of that. Up until now, baby, because we're still in Corona. A lot of these clinics, they close by 12 noon, they're closed. So it tells you, first of all, you have
then what happens in the afternoon?
See, now you have to wait for the next day.
So because sometimes the doctor has gone to another clinic and the doctors are also few in the rural areas.
So that is what even this period showed. It showed that beyond even transport and beyond accessing the actual health facilities, are the ones that are near, are they actually equipped? Right? Because ideally there's a whole protocol to what services that you're you're accessing at that level. Going to Kenyatta is when you're really, these tertiary institutions, the level 6 and level 5 hospitals, you're only going there when it's specialized care. Yani uko sick, ama you need specialized care. You need to access the one that's near your dispensary, your hospital at the county level.
And you know, that's why a lot of Kenyans have become self-medicating doctors. We go to the chemist and we say the disease we believe we have. We even ask for the medicine that we think we have before we say, "Oh, what do you think?" You know? Yeah.
But the systems are not there. But then you also have to be informed. I think the more important thing is actually before you act, know what you're doing. Don't just, not because you've had people, the people referral system where your friend told you and it becomes another
Facebook
informal
doctor.
health Facebook doctor. So it's important to take charge, but then also remember as a citizen, as a tax-paying citizen, that there are certain services that you are entitled to, that your leaders are supposed to ensure are there. So if they're not there, you don't also say, okay, let's create another alternative system. You ask them, why can't I access my Calpo in my dispensary? Why can't I get a Moxil?
Yeah, because a number of times when they say the free medical health care, you go and then you're prescribed for a drug which you need to go and get from the chemist. Even the book, in the Oshago place there's the book. You have to buy the book first, and this book became from 10 bob to 50 bob suddenly. And so that's what the one you used to see the doctor, and then you have to go buy medicine. So it's like consultation is free, but medicine is not free.
It's not. And you see, that's in fact what you've just said also is a current problem that we're facing. As a country, we are transitioning into universal health coverage, which is the promise that everyone anywhere can actually have access to quality healthcare without facing financial hardship. One of the nomadic communities where they had such a forum, not at a county level, I think it was at a sub-county level or even ward level, and the communities they were having, the prioritizing and saying this is what we need for our development. So the community said, by the way, we need a pharmacy or dispensary. And they said the response that they got from the leaders was, actually, we don't have budget, but we're going to budget for it. But the community was like, no, it was budgeted for. In fact, this is the amount.
Wow.
And became a dialogue, and then they said, then the government was like, oh, but getting this, there's a whole story of how they could not activate those funds because they've been doing what, and the communities kept on, the leaders who are representing kept on giving them comebacks, like, no, but this, you're supposed to do this. Do you know, at the end of the day, without going to details, they actually came and they need, in fact, they said, and this is what they said, as that is being activated, as a community, we can help do ABCD. Wow. So you just come and we start. And so, as a government, you put in a corner because they never expect that. What they expect is mapambano of activism. What they expect is noise, but also that noise has to come from knowledge. You don't just say, because I know my rights. You have to actually engage with your leaders based on information that you've read that is provided. And I think that's why the negotiating power comes. Before you see things are going,
you can't really
if you're not informed, what are you negotiating? And so it speaks to that, and that's why it's so important. The leadership from the ground is so important, and you don't have to have a chair. You don't have to be a CATI community representative.
You just need to be a leader of a women group, Even
just to be you and enter spaces and speak out.
My mother always says, when you go to an event, just try and ask a question.
Even one.
Because it keeps you accountable and keeps the other person also accountable.
And also challenges you, because then are you just going talking? See, now you have to, it keeps you, like, you feel engaged, you also feel very important, which you should be because you are in such forums. So I also am that person. I'm that person. Kwanza from school, I was always that person who was like, teacher,
I have a question.
Kwanza I'm in front.
I like the front seat too.
Paka Campo, by the way. Till campus, I was in front and I'd always ask questions. But I'm reaping the benefits now because I'm like, because I don't feel ashamed when I enter any space. I don't care if it's high level. I'm here. I am going to speak. I'm not just coming here to sit down. So that is me.
Great. Now, Sandra, tell me, where do you see White Ribbon Alliance going, and you?
Oh, wow. So as a movement in Kenya, we have a long way to go in terms of growth. Right now, we have a passionate network of champions, but we see us growing countrywide. Wow. We are membership-based. Right? We are not just technocrats sitting driving this work. We're membership based, and so we want to grow our membership across all the counties. Right now we have a few activations in the counties that we work. So we see ourselves growing as a movement, but more than that, we want to see the impact of what we're doing, because at the end of the day, what we want to see is that women and girls have universal access to quality healthcare. And so we want to see that in our policies. We want to see that, when we're talking about reproductive health bill, that touches us. We want to see that such policies actually are passed, because that shows investment.
Exactly.
We want to see budgets on the same. We want to see quality, equitable, and dignified care when we go to our hospitals. And we want to hear the stories from the women and girls saying those things. And we want to see an empowered group that speaks out all the time. When we see things like what happened in Pumwani,
people speak out.
We want to see more speaking out, especially from women and girls. And so as from a movement level, that is what success looks like. Even as we impact our neighbors, we also have the movement in the region, but we want to be a good example. We want to set a good example for our region, but even globally, to show what does it really mean to activate the power, the innate power that we believe women and girls have.
Tell me about membership, if I want to be a member.
As a member, what you can do, it's very simple. You reach out to us, and then you can reach out to us on our social media handles. So on Facebook, we are White Ribbon Alliance Kenya. On Twitter, we are WRA_K, which comes, you'll see White Ribbon Kenya. We have a very active comms team who are also very passionate members and volunteers who always like engaging with people who want to join the movement. And you'll get a lot of information. But you can also go to our website. Our website is whiteribbonalliance.org. There you'll find a nice very short questionnaire of your name, which country you're from, and then we're able to access the database.
So all I need to join, I don't even need to pay subscription fee.
No. It's you. In fact, when I'm almost telling you already a member by coming to our space, you're a member, but also for us to capture your details and to also have engagement after. We should be doing a membership drive soon, just to speak to what we're doing. And right now we want to start 2021 very strong. And so we will all of this will be available on all our social media channels, but also our website. It always has information that leads you towards knowing how do you want to take action, how do you want to be involved, and even just getting information about our work around the adolescent health, mothers, citizens, self-care. Kwanza self-care is important. I'm preaching it this year because of COVID. It's so important. It showed the importance of it.
True. Wow.
For me, where I see myself, I've always found myself in movements, and I think I see myself continuing to championing for the rights of those who are, who with them, not of, with them, of those who are disadvantaged by the system. I see myself claiming regional spaces and global spaces, but not as an individual, with a group, a group from the community, because I feel at the end of the day, my work, and I've seen my work a lot, has always been a connector. There's so much that I have to share. But thank you for allowing me to even share these things. I'm happy where I am because there's so much work to be done. But we need more people to join us and do what we're doing.
Thank you.
And I thank you for the time.
Guys, this was Sandra Mwarania, and you heard all that she had to say. She's very passionate about maternal health care. All I can say is let's ensure we have information on self-care, and let's keep our women and girls in check. Maternal health care is not a joke. Every woman needs it. Even when she's a girl, even before she gets pregnant, a woman needs to know about her reproductive health. And that's what Sandra and the White Ribbon Alliance is trying to empower us on. And until next time, this is the Necklace Forum. Subscribe to our YouTube channel on Dr. Zippy Okoth. Watch this episode and many other episodes, and let's keep it here, telling positive women's stories. Bye-bye.
Bye. Bye.